While standard precautions are precautions that we use for all patients, the second tier of precautions includes precautions designed for the care of patients who are known or suspected to be infected or colonized with microorganisms transmitted by droplet, airborne, or contact routes. The three main types of transmission-based precautions are contact precautions, droplet precautions, and airborne precautions. With contact precautions, everyone must perform hand hygiene when entering and before leaving the room, just as with standard precautions. Also, providers and staff will want to put on gloves before entering the room and put on a gown before entering the room. The gloves and the gown are then discarded before exiting. Do not wear the same gown and gloves for the care of more than one person. You also want to use dedicated or disposable equipment. Clean and disinfect reusable equipment before use on another person. So if you have a patient on contact precautions, you don't want to wheel in a vitals machine into their room, use it, and then wheel it into the next patient's room. Hopefully they would have dedicated equipment in their room. If not, if you did have to take equipment into their room and then take it out and use it again elsewhere, you would need to disinfect it well before using it on another patient. Droplet precautions focus on diseases that are transmitted by large droplets. Droplet precautions require the wearing of a surgical mask when within 3 feet of the patient, proper hand hygiene, and some dedicated care equipment. With droplet precautions, as with everyone, as with standard precautions, the provider or the nurse or the student nurse must wash their hands before entering and leaving the room. They also want to make sure their eyes, nose, and mouth are fully covered before entering the room. Remove face protection before exiting the room. Airborne precautions focus on diseases that are transmitted by smaller droplets, very tiny droplets that can remain in the air for longer periods of time. Airborne precautions require a specially equipped room with a negative airflow referred to as an airborne infection isolation room. Air is not returned to the inside ventilation system but is filtered through a HEPA filter and exhausted directly to the outside. As with standard precautions, everyone must wash their hands when entering and leaving the room. Providers would also want to use a fit-tested N95 or higher level respirator before room entry. Providers will want to remove the respirator after exiting the room and closing the door, and the door to the room must remain closed. So let's review. Standard precautions are precautions that we use for all patients. And this includes hand washing, wearing of gloves, when concerned about touching blood, body fluids, secretions, excretions, non-intact skin, mucous membranes, or contaminated items or surfaces. Also disposing of sharps or needles correctly, as well as biohazard materials. So there's policies that will need to be followed at the facility in regards to how soiled material is handled. One thing, even if it's not blatantly soiled, linen should be handled with care. They shouldn't be thrown on the floor to be gathered later. They should be put in the designated bags or place that the facility requires in order to practice standard precautions. With contact precautions, we want to make sure we are donning gloves and a gown. We're worried about direct contact with the patient or with the patient's environment. Frequently in the hospital setting, the nurse will use contact precautions if the patient has MRSA. Also, if the patient has C. diff, which is a form of very contagious diarrhea. With droplet precautions, the nurse will want to wear a mask, and if facility policy dictates, they may be required to wear eye protection also. Commonly in the hospital setting, patients with influenza or the flu will be on droplet precautions. Airborne precautions are used for those diseases or infections that cause the very, very tiny droplets that can actually be suspended in the air. They're so tiny. Previous to COVID, Airborne precautions were used or seen most commonly with a patient who had an infection with tuberculosis. Now, though, we see patients, or we see providers rather, wearing N95s and practicing airborne precautions with patients who have COVID-19. A term you should be familiar with is aerosol generating procedures. And these are procedures which enhance aerosol production from the patient. They include intubation, right, when the tube is entered into the trachea for ventilation, as well as mechanical ventilation, where the provider is using the bag valve. Both of those are considered aerosol generating procedures. You may work at a facility or have a clinical at a facility where there are different procedures in place if the patient is going to be undergoing an aerosol generating procedure. Obviously, the risk of transmission for infection is greater when the patient is receiving these types of treatment. COVID PPE includes an N95 or another form of respirator, a face shield or eye goggles that have covers on the sides, gloves, and a gown. You want to follow your facility guidelines regarding requirements for COVID PPE, as they can be different from facility to facility. We've talked about the N95 mask, which is used with airborne precautions. The N95 mask has a very tight fit if fit properly. A lot of facilities, all facilities should have a fit test when you're issued an N95 to ensure that it has a correct fit and seal so that it works properly. If it is working properly and has a good seal, the N95 should eliminate 95% of airborne contaminants for the provider. A PAPR, also known as a powered air purifying respirator, is another type of respirator that can be worn with those airborne precautions to help keep the provider safe. So let's talk briefly about signs and symptoms of COVID. And we're doing this because, one, we want to make sure that you recognize signs and symptoms of COVID in a patient in the clinical setting. And two, we want to make sure that if you are experiencing any of these signs and symptoms, that you follow the proper procedures so as not to infect others or go to clinical and make your patients sick. Symptoms may appear 2 to 14 days after exposure to the virus. Symptoms include fever or chills, cough, shortness of breath or difficulty breathing, fatigue, muscle or body aches, headache, new loss of taste or smell, sore throat, congestion or runny nose, nausea, vomiting, or diarrhea. People seem to get wide ranges and varieties of these types of symptoms, so it's not necessary that you experience all of them. If you are experiencing any of the symptoms that are listed with COVID, you would want to stay home. Please don't go to clinical. Don't come to class if you have a scheduled exam or we are meeting on campus for lectures again. We want to make sure that if you are exhibiting signs and symptoms of COVID, that you remain at home. You'll want to email covid@tara.edu if you are experiencing signs and symptoms of COVID. You would then receive instructions as to how to proceed, most likely getting a test, seeing if you're positive or negative, and you want to follow any guidance provided from the email site. So you may be asked to isolate based on a positive, or to quarantine based on exposure. Even if you're not having symptoms, any and all of your COVID-related questions should be directed to covid@tara.edu. Please know that your faculty and your instructors here at Tara will work and will try our best to be flexible with you. We understand that due to the pandemic, some things are just out of our control and that we may miss clinicals even though we don't want to, even though we feel great, but our partner is homesick with a positive COVID diagnosis. So please know that we'll work with you the best we can. We do need to ensure that course outcomes are met. So obviously we have to look at each case individually to make sure that the student isn't missing too much school or too much clinical, too much coursework to not be successful and achieve all of the course outcomes. But we do expect to see students have to quarantine and isolate throughout the semester, and we will work with you.